Welcome to Scope. I'm Hannah Jaku. What appears to be a second outbreak of positive COVID-19 cases in Port Moresby these past few weeks prompted the government to announce new measures. However, it avoided a complete shutdown of services. Instead, authorities and its supporting agencies ramped up testing, and on August 2nd, St. John's Ambulance PNG set up a drive-through sampling collection facility at the Tauranga Aquatic Centre here in NCD. So to support what the National Department of Health is already doing at Rita Flynn, St. John's is working closely with the PNG Defence Force, whose medical officers will collect samples through the swab kit, and these samples are sent off for testing at an authorised laboratory.
You should only come for testing if you have fever or a cough or a sore throat or a runny nose. We will only test you if you have one or all of these symptoms. You'll be turned away if you do not have COVID-19 symptoms. We are expecting a large number of people to come here, so there may be long queues. People may have to wait for several hours. We suggest bringing food and water along. So if you're sitting in the car for a while, you can stay hydrated, you can have the nutrients you need. And when you're parked in the queue, you may want to bring something along. We'll do our best to get to everyone as quickly as we possible, but as I said, there'll be extended waits. And the reason for those waits is that while the testing, the sampling itself is quite quick, we have to do it very carefully to make sure that there's no cross-contamination, because the safety of our team here is number one. If you are in the queue and you're feeling very sick or you become very ill, you can put your hazard lights on and one of our nurses will come assist you. The samples that we do will be taken by St. John or PNG Defence Force soldiers. The sample is a nasal swab. The nasal swab goes in through the nose. It's unpleasant, it's uncomfortable. It shouldn't be painful, but it is uncomfortable, and it will make your eyes water a little bit, and it might make you sneeze. But it is safe. It's being done by, as I said, it'll be done by health workers, either from the Defence Force or from St. John or from NCD PHA. The samples will be stored in a fridge. St. John is not doing the testing, we're doing the sampling. The actual tests will be done as a PCR test, and the samples will be given to the National Department of Health to have them tested in an authorised laboratory, whether that's IMR or another laboratory. That's up to the Department of Health.
This joint initiative involves private-public partnership and donor-funded support.
We're going to do this as a 2-week pilot. If it's working successfully, then we will continue it, so long as there's support from the Department of Health to continue it. But this has been funded by the New Zealand government, has helped us to put this on. So I think it's important that we thank the Department of Health for their guidance and support throughout this, the World Health Organization, the PNG Defence Force, and of course the National Capital District Health Authority, and the Tauranga Aquatic Centre, who's been great. But what we've also been able to do is bring together some of the business community to support. And what you're seeing behind is a contribution from Red Sea. They're loaning a shipping container so that our people doing the sampling can put on the PPE, don the PPE, and also doff the PPE. It's very important we can do that in a place away from the wind, because actually the most dangerous part, the most risky part of your interaction with a patient when you're wearing PPE isn't when you're with the patient, it's actually when you're taking off your PPE. So we need to do that carefully, and we need to do that in a space that we have safety.
St. John's does provide ambulance services in East New Britain Province. However, this specific drive-through setup is being trialled initially in NCD, and they will look at Moorabbin and other centres pending the situation. While sampling and testing has increased, so too has awareness when the government, led by Prime Minister James Marape, announced a community awareness program to be conducted by non-essential public servants.
We have examples of nations around us who are aggressive in awareness and aggressive in the non-clinical strategies, and they used it effectively to shut down the virus from spreading. And so I'm happy to be part of this occasion in which we formally launch out to our people out there in the suburbs, in the settlements, in the villages, in our city, as well as right throughout the length and breadth of our nation. Every public servants are essential to our country. I'd rather use the word we've scaled down, and those that are in the house and not coming to work are being mobilized to continue to be deployed, to be agents of disseminating proper awareness to our country and our citizens and residents in our country. It's that we belong to a special group of Papua New Guineans who the nation is paying us money every fortnight, every year, and so our contribution in this effort to spread information out there without demanding on allowances is proper for us to do.
The strategy highlights 3 key areas. Number 1, PPE distribution. Number 2, awareness and impact assessment. And number 3, support awareness or reinforcement of messaging and prevention. Authorities hope by engaging the public servants to be proactive in their neighborhoods and communities that this will work effectively to promote vital information dissemination surrounding COVID-19 and make people understand that by taking individual ownership and responsibility and following the control measures, this will cut down on the stigma that comes with ignorance and lack of information. Community development is engaging some 200 staff for this strategy to be supported by additional staff from the Department of Public Service and the Department of Personnel Management. While the Prime Minister asked for public servants to volunteer their time and efforts to give back to the country, the Minister for Community Development, Youth and Religion is a man of few words who summed it up.
Tupla something you may help him, prevent him. Now people kisim displa virus, now all go inside long all care centers blow you me, hospital blow you me, all by help him grow him economy blow you me. Now by display and by stuff. So go end in end, you may help him all people, you may save him economy, you may save him country.
After the break, the Health Minister elaborates on the government's efforts so far. Stay with us. Papua New Guinea had the benefit of being one of the few nations not immediately ravaged by the initial outbreak of the COVID-19 pandemic. As other countries faltered and buckled against the onslaught of this virus, locally the threat seemed to be contained. But while many feared the worst, the news was still met with complacency, and restrictions like the initial state of emergency were not imposed. How has this aided the community transmission we are now seeing?
We're prepared as much as we can. We were expecting the second wave, and if we listen to the reports that the deputy controller was putting out, he already said that within July, August, we will have the second wave, and then in November we'll have the third wave, probably within the rural areas.
How important is it for the health advice to be followed by the public?
Very important, very important. I was one of those people in the public that didn't really believe in following orders and that. And after going through the system and having a look at what people are doing, it really opens your mind. I just hope that people actually listen to the advice given, because when they don't, it creates there's people out there that don't believe it, and they try to push it out and try to get people to follow them to not to believe it. But the thing is, if you don't follow it, it's real, it's out there, and we've already lost 2 lives, and maybe they didn't die from COVID-19. Maybe they had other diseases, but COVID-19 played a part in it to shorten their lives. So I take it very seriously, and when I see the statistics coming from outside, it scares me when it comes to our country.
He was in a video conference
So with the fear being very real amongst our leaders, this transcends down to the public. The country's COVID-19 response is critical, and many are fearful of the spread of the virus. Government funding has given massive allocations, but it's knowing what areas this money is going to that will give the public some comfort.
To date, off the top of my head, probably altogether about 65 million kina. And most of that has gone into building isolation centers, getting PPE gear, all through the process, through the health process, through the procurement process and everything.
We have Rita Flynn. Is that the only quarantine facility here for NCD?
No, we have the Dogura facility coming online. They just finished payment on that, and they just finished building on that, so we should open in the next week or so. And we're also looking at the John Guy's indoor stadium as one as well. So we're preparing for more cases if it comes to that. All provincial health authorities are being funded. I have a list from Treasury as well as my finance people that money has been allocated to PHAs as well as the grant funding, which will probably go through this month. Every PHA will be funded here.
News hit social media before mainstream, and the recent public appeal made by the Port Moresby General Hospital generated mixed reactions by the public, considering the announcement of the COVID-19 funding.
Yeah, people got mixed up with that POMGen appeal. That Port Moresby General appeal is what happens usually every year, and that's sanctioned by the Deputy Chair Lady of Port Moresby General, Miss Kathy Johnson. And they do that every year for the mothers. And I mean, the timing was wrong for them to bring it out now, but it doesn't mean that we haven't given any funding to POMGen. We've done a lot of funding to POMGen. We have a lot of infrastructure building with POMGen that continuously, the cancer side of things, and also some wards that we're doing. I don't think the timing was right for that to come out, and it's sort of a lot of people misconstrued the message.
And what is the worst case scenario for Papua New Guinea when, as a Melanesian society, we are communal by nature, so births and deaths bring people together? Of the 11 new control measures, number 5 concerns the burial of deceased persons from COVID-19.
Our worst case scenario with COVID-19, if people do not adhere to the laws, the measures that we put out now, like wearing a face mask, washing your hands all the time. If you get on a bus, every person has a responsibility. If you get on the bus and you see people that are sitting so close together and have no mask, then you either be a sheep and you join them and get COVID-19, or you be a shepherd and you put on your mask and you tell them, say, hey, you're risking everyone else's life. Why should you do that? Or you don't get on a bus and you get on another bus, or you follow people that are following the safety protocols.
What process is in place in the event that we have these COVID deaths? Is the body returned to the family, or is there a special process?
We have a system where it'll go through the morgues and the protocol, the normal protocol, and I think I don't know too much about it, but I think they will be held for some scientific checks first before they're let out. Because of the 2 deaths we had at underlying health issues, we're still working on the autopsy on that one.
A question many continue to ask is the status of the persons who first tested positive to COVID-19 but have since recovered. Can you tell me about what's happened to the original cases? If they've recovered now, have we documented that process so we know specifically what medication they've taken?
Yeah, it depends. When our first patients have already recovered, their medication was just simple antibiotics and that, and the time they isolated themselves, and the virus went out of their system. We've had a lot of recoveries from our COVID-19 patients, but our scientific group are still looking at it and trying to help, because every country has to put a report in on their patients, so it goes back to the World Health Organization, where they all put their advice together to come up with a solution, and they look at different ways of mitigating the antidote or the vaccine, and they work out how people how they lived and how did they get it, and what measures they took, and then they study all these things. So it's a long process.
And on the issue of the sudden spike in cases, identifying the hotspots and knowing whether the border provinces will remain a priority.
The lockdown had a lot to do with the low mortality rates and the spreading of the first wave of the COVID-19. And coming into the second wave, I have to admit that we really let ourselves down now. We got complacent within the health sector there, and as you can see with the numbers, most of the people that got the community transmission were from the health sector, and that's probably because we maybe didn't wear the mask at the right time, or we didn't have a glove on at the time, and because this bacteria, this virus, can be somewhere, and you just have to touch, or you just have to cough onto somebody, and it passes along.
How was the hotspot areas in NCD alone identified?
They'll be identified through where people live and how the response unit is tracking them. And then from there, what we do is if we see a huge number there, we set up a portable aid post center, so that people can come and do the checks. And then from there, we can separate and segregate people from, if they get the COVID-19, we shoot them straight down to Ritter Flynn. And I think after every 14 days, we allow people to get out. So,
with the concentration of cases just here in NCD, are the border provinces still priority areas?
Border provinces are priority. No matter what stage we get to here, there'll always be a priority. Indonesia's numbers are going up, and that's a very scary issue for us, because there's a lot of places that along the border where they can infringe into PNG, and sometimes on the border you don't know who's from the other side and who's from our side, because they've all been living together and it's communal, and that's one of the scariest things. That's why the next lot of testing will really push up in the border areas.
Now, it may be all good and well within Parliament. However, for everyday Papua New Guineans already battling to survive in a harsh economy, the availability of basic health services isn't as easy as walking into any local clinic. This story after the break. Imagine being a heavily pregnant mother 2 months shy of your delivery date. And with birthing plans all set, you are then told by a nurse to buy umbilical clamps and plastic sheeting to prepare yourself for a home delivery. A social media post went viral by a frustrated mother after her routine antenatal checkup recently left her emotional and distressed.
That particular morning of all other mornings it was all right. I think because of the PMVs not running, they normally take 30 a day. So the first 30 mothers that go in, they are fortunate to get served, and the rest have to be turned away and they have to come back later. I counted 18. They started off with the usual routine with our devotion, and then on to getting our weights, and then we were referred to the back to where we normally sit and wait for the nurse that comes out to checks us, and then we go into the examination rooms for further checkup. And that's when one of the nurses came out. She's a familiar nurse down at the clinic. But anyway, she came out and she said, "Oh, we'll start off with number 1." So she gets the first card, and I'm the 10th person in line. So she's looking at it and she's saying, "Oh, I'm just gonna go through your book, and you'll have to come back after the lockdown. Those of you that have to come back after the lockdown, you come back after the lockdown. But those of you that are already, ready to give birth and whatnot, from here I want you to go home and go to the pharmacy and arm yourselves with clean razor blades and 2 umbilical cord clamps and a plastic mat or something." And this is something I've never actually heard. I'm sitting there and looking around like, is she seriously telling these mothers this, or is she seriously telling us this? And so she's sending them away, and then there was one lady that said, "Look, I need to get checked. My baby's not sleeping the right direction right now. It's transverse." And she's like, "No, you're okay." And I don't know whether it was just a bad day for her or whatnot, but then the part that I got disappointed about was the information that was given.
Lina, a mother of 2, felt she needed to clarify the information being given, not just for herself but for the other women, many of whom shied away from speaking up.
And I have no idea about midwives, how they do things, and I just learned a lot from her that day, that there's clamps that we had to go and buy. And I'm like, I can't believe you're telling us this. So you're telling me that I'm going to go home and deliver at home, I asked her. I'm 8 months, and you're telling me to prepare myself for home delivery. And so she's like, yeah, because, you for your baby's safety. You don't want to go to the hospital and get, but my baby is important, I am important, I need to be supervised during my delivery.
Meanwhile, Lina's partner, while initially distraught at hearing of her encounter, says his main concern was that she was safe. While the couple says they will continue to go to the 6 Mile clinic and have no issues with staff or management, they hope by sharing their story that those in authority realize the importance of giving out the most accurate information to people, especially during this time of crisis.
I would practically move mountains to ensure that my family, we've got 2 kids already, and we have 1 on the way. It's not like we're first-time parents. Going through this and, having the support of our local clinic is, it's highly respected from us. They have trust that the information they're getting is first-hand. If they can come down to that level, to the clinics, and give them the correct information, then, proper awareness can be given to the local community.
Lina says the nurse had referred to Dr. Glenn Moller's media reports encouraging women in PNG to avoid pregnancy during this pandemic, and this instilled more fear into the mothers. The spread of misinformation prompted a response from Dr. Moller, refuting claims he had told mothers to deliver at home, and also one from Dr. Mary Bagita, coordinator of obstetrics and gynecology at the Port Moresby General Hospital, refuting the incident had occurred. Lina says she did not expect the post to go viral, but clarified to Scope that this incident took place at the 6 Mile clinic and not Port Moresby General Hospital as claimed in social media responses. We wish the best for Lina and Marioso during these difficult times. While the government is serious about its efforts in combating this global pandemic, we trust they have not forgotten the other diseases that kill many Papua New Guineans on a daily basis. And the fear of misinformation and negligence is that those without access to accurate information become part of the high-risk category. And where does PNG sit on the global tally for this current pandemic? On the global tally as at 6 August 2020, according to an online portal worldometer for COVID-19 coronavirus pandemic, out of 215 countries, Papua New Guinea is listed at 180. Out of the nations listed for the Oceania region, PNG sits 3rd after Australia and New Zealand. Based on updates from the National Control Centre in Port Moresby as at Friday 7th August 2020, PNG now has 188 confirmed cases. 10 in the Western Province, 1 in West Sepik, 1 case in the Eastern Highlands, 1 in the Southern Highlands, 3 cases in Morobe Province, 1 in the Autonomous Region of Bougainville, 2 in East New Britain, and 169 cases in NCD. Other data shows that of the 188 confirmed cases, 25 were new cases as of the 7th of August, 109 are active cases, 53 recoveries, 3 deaths, and a total of 10,808 tests have been conducted.
We see the landscape changing overnight in as far as COVID-19 is concerned. We're dealing with a global pandemic, a virus that has infected over 16 million people worldwide and claimed the lives of over 600,000 people. Whilst there are doubters and skeptics out there, criticizing the NCC and the government's efforts at every step of the way, and as far as the steps that we're taking, let me reassure you all that our pandemic response efforts are the best possible practices that we've sought our best legal and medical advice on in terms of how best we can also respond to the COVID-19 pandemic in the country.
If you have any questions or issues you would like us to raise here on Scope, please contact us through our Facebook page. A reminder to please adhere to all health measures and protocols. The easiest way to protect yourself and your families is to wear a mask, sanitize, and stay at home. Scope will bring more updates, so tune in again next week. I'm Hannah Jaku. Goodbye.